the most optimal, long-lasting, and most effective way to decompress the spine is related to intra-abdominal pressure. We're going to talk about some of the various ways and treatments for spinal decompression and the ideal or optimal way to decompress the spine. Spinal decompression, or otherwise known as traction, is a way to basically separate the vertebrae of the spine so that the discs can imbibe fluid and create some space there. Degenerative disc disease would be a perfect example of the disc is the space between the vertebrae, and if that disc is degenerating, we have less space there. We have decompression, various methods of decompression, and it's going to pull apart the vertebrae. So all of the vertebrae will have an axial force on them, like a longitudinal force pulling the spine apart that will open up the space, it will decompress the disc, and it will allow fluid, which is the majority of the contents of the disc, to go back into the disc. One example would be an inversion table. There are other ways as well. You can go into a physical therapy clinic and they will sell you a treatment called spinal decompression. They're hooking you up to a traction device or a machine where you're typically laying on your back, and it pulls your upper body apart from your lower body, and it's separating all the vertebrae and discs in between. Very similar effect as an inversion table. These are probably two of the most common ways, but there is another, and that is hanging. So dead hangs, or even, if you're doing something active while hanging. What can be some of the issues with spinal decompression? Well, when you take static tissues, which is a disc is a static tissue, ligaments are a static tissue, and you hang on them, it stretches those tissues out. Stretching is good for muscles, but muscles are dynamic tissues. Muscles are tissues that we have control over. And so we can go, hey, brain, contract this muscle and shorten it. But we can't do that with ligaments. And discs are just another form of a ligament with fluid inside. Stretching ligaments is not necessarily the best thing to do. So we've got a disc. The disc has compromised tissue over here. It's not holding the contents of the disc in properly, and it's bulging. Let's take this compromised tissue and let's stretch it, pull on it. This is what inversion does. You're hanging a lot of weight on this ligament right here, this disc. How is that going to affect the compromised tissue that's too stretched out, too lax, too broken down? It's going to stretch it out even more. It's going to potentially make the problem actually worse, contribute to a bulge or sciatica. If you've ever had an ankle sprain or a knee injury like an ACL or MCL sprain, those are examples of overstretches of ligaments. So you have this lax ligament. Well, that's how chronic sprains can happen. So we don't necessarily want our ligaments to be loose or lax. They're supposed to have some tautness to them, and that's how they support things like the spine. When you're hanging upside down or you're hanging without any muscle engagement, essentially you're hanging on your ligaments. Maybe the benefits of decompression outweigh the cost of giving a little stretch to your ligament. Maybe there is a possibility that decompressing this disc for a period of time was able to decompress the nerve because the nerve was stuck in a certain position, trapped by the disc. And so these would be outlier situations where there's only one way to find out is to give it a try. Now, there's another thing that I don't really love about spinal decompression, the fact that the benefits or the effects of the decompression are temporary. In general, it does not have long-term effects or lasting effects more than, say, a few hours. And that's because if you take the weight off of the spine, pulling these vertebrae apart is going to decompress the disc in between the vertebrae. As soon as you stop pulling the vertebrae apart and you re-weight the vertebrae, you put it back in a weight-bearing position, there is no extra support that's been added. So you have the same amount of pressure or stress back on these vertebrae as you did prior to getting the decompression. You're just temporarily decompressing the disc, allowing some fluid to come back in, but within a matter of hours, that fluid is going to get squished back out of the disc. And that's what happens to all of us every day of our lives. You are taller in the morning when you wake up than you are at the end of the day, because throughout the day, your discs are losing fluid. Anytime you get horizontal, your discs are imbibing fluid. Studies show that the first hour of laying down at night, majority of the fluid imbibes back in your disc. But within that hour, the majority of the fluid comes in the first 15 minutes of that hour. So even laying down for 15 minutes, even 5 minutes, you're going to get some benefit from that. And so I'm much more in favor of long-term solutions that are going to have lasting effects beyond a matter of hours or even a matter of days. That's what's going to lead me into hanging. It really invites the possibility of adding some active elements to decompression. So you're hanging, from a pull-up bar, so you're unweighting your spine. You're not really intensely overstretching your ligaments because you can combat that by doing some core engagement, doing maybe some healthy core contraction of your muscles and training those muscles in a decompressed state of the spine. It counteracts the problem. You're no longer overstretching your ligaments because now you're hanging more on your muscles and you're also training your muscles in a really healthy decompressed state. You could be doing knee lifts. Now, I'm sure this begs the question, can't you add an active element, active exercises to an inversion table? And my answer is yes, you can do that. You're hanging from your ankles. You're usually up against a board on your back. So you could be engaging your core. Say if you're a core balance training student, you can be connecting your back anchor while in that inversion position. I would not be doing crunches or curl ups or sit-ups from an inversion table if you already have a compromised spine. Then that brings me to decompression in a clinic, physical therapy clinic, chiropractic clinic. I don't know that there's a whole lot you can do. You have an electric machine that's pulling you apart. They typically you're under supervision, instruction to just lay there and let the machine do it to you. So that would probably be my least favorite form of spinal decompression. And so that's going to lead me into my preferred method of spinal decompression, the most optimal, long-lasting, and actually most effective way to decompress the spine is related to intra-abdominal pressure. As you inhale, the diaphragm is coming down like a parachute that's inverting, and it's actually pulling air into your lung, but it actually creates pressure down below, which increases your intra-abdominal pressure. If you understand physics, is directly related. There's a linear relationship. As you increase pressure in a system, it increases the stability within that system. A spine that looks like this is unstable, and we want to stabilize it. We want to create pressure around that. That is the best and most effective possible way on planet Earth to provide support and stability for your spine. Way more effective than contracting muscles. When you contract any of these muscles, all we're doing is shortening them and they're compressing. So they're increasing compression on the spine. Muscles do not decompress the spine. They have no way to do that. We keep the muscles around our cylinder engaged in a static, healthy way, and we inhale into that. That can decompress the spine. This could be our core, and if you contract the core around the egg and increase the pressure within that egg or whatever this is, it will actually lengthen, if that makes sense. This is a really healthy, beneficial way to decompress the spine through pressure. The cool thing about it is this is done with our breathing, and we breathe all day long. So if we can increase the quality of our breathing, so if we can close off the leaks, especially in the front with our abdominal muscles, of pressure escaping our core. When we inhale, we will be providing a gentle, subtle amount of decompression in the spine. This is an unhealthy muscular system because the diaphragm is angled forward. All the pressure is escaping out of the front of this person's belly. The pelvic floor is actually also angled forward. And this is a really common pattern where the pressure is lost out the abdomen. And you can see increased pressure on the posterior aspect of the spine, where if we can get the muscles in balance here, we can close off that leak off of the front of the abdomen, and that diaphragm comes down. It will increase the pressure inside the system, creating the Coke can analogy of a very stable system. That is my absolute favorite way to decompress the spine, is through your breath. One of the most powerful ways to do it. This is all day long. If I want to decompress my spine, the first place I'm going to look at is my breath. The second place I'm going to look at is outside treatments. If there was Someone who should not do an inversion table, it would be a person with spondylolisthesis or any form of existing instability in their spine, because hanging on your ligaments through something like an inversion table is going to take those unstable ligaments and make them more lax, more stretched out, and contribute to the instability in your spine. If you're going to hang, make it an active hang and engage your muscles in a healthy way so that you're not hanging on those already stretched out ligaments and stretching them out even more. Until next time, get down on the floor and connect to your core.